Hello everyone, my name is Dilruba Akia and I am going to talk about tobacco smoking should be banned. Tobacco is made by drying leaves from tobacco plants. Nicotine is the main chemical in it. Tobacco smoking is when people burn the cigarette and smoke it so that they can breathe it or taste the smoke. In this presentation, I'll talk about how tobacco smoking affects the atmosphere, people's health, and a non-smoker. Now, what's the first thing come in your mind when the question is what happens when you smoke? In general, you are going to think it may increase blood pressure, rises heartbeat, linked to the cancer, reducing lungs function, and many more. But do you really know how long does it take cigarette to harm you? It just take a second. Nicotine is the main chemical in it. Along with nicotine, people who smoke inhale 70,000 other chemicals with cigarette smoke. When you inhale cigarette smoke, it goes to work on your heart, your lungs, and your entire body. It started your heart pounding an extra 15 to 25 beats per minute, raises your blood pressure by 10 to 20 points. All of this happen with every cigarette you smoke. Her name is Amanda. She picked up her first cigarette in grade 5. And by age 13, she smoked every day, even she used to smoke while she was pregnant. Amanda was about 7 months into her pregnancy when things started to go wrong. She was rushed to the hospital by ambulance. Her baby was born 2 months earlier and weighed only 3 pounds. She was put into an incubator and fed through a tube and received a special care for premature babies. Now at age 7, the girl takes 4 medicine on a regular basis. Moving into the argument of my topic, at first I want to talk about why tobacco is bad for the environment. Tobacco smoke produces fine particulate matter, which is the most dangerous element for environmental pollution. Per day, cigarettes add to pollution as people consume them and releases toxins into the air. Due to the heavy inflow of pollution in the atmosphere, global warming has become the main problem. According to the World Health Organization, about 4,200,000 hectares of land were devoted to tobacco production in 2011. Global tobacco production was estimated to have produced more than 2 million tons of solid waste, 300,000 tons of non-recyclable nicotine-containing waste, and 200,000 tons of chemical waste in 1995. Moreover, cigarette smoking produces carbon dioxide, methane, and chlorofluorocarbon emission, which are the main polluting gas in the atmosphere. Those emissions boost the global temperature by trapping ambient solar radiation. Furthermore, cigarette butts are the most frequently discarded pieces of waste, which also reported harmful compounds such as arsenic, mercury, nicotine, ethyl phenol. Consequently, it is clear that tobacco products negatively impact and damage the environment. Secondly, smokers are in danger of losing their lives to preventable health diseases. There are more than 70,000 chemicals in a cigarette. 250 chemicals are known to be harmful, including hydrogen cyanide, carbon monoxide, and ammonia. Among the 250 known chemicals, at least 69 can cause cancer. Around 3 million Australians are daily smokers, and it kills over 15,000 Australians each year. There are some short-term and some long-term effects of smoking cigarettes. The short-term effects produced by tobacco include increased heart rate, blood pressure, brain and central nerve system activity. Equally, the long-term effects of tobacco include stroke, blindness, mouth cancer, heart diseases, heart attack, lung cancer, and stomach ulcer. Tobacco smoke affects almost every organ in your body, causing many diseases and reducing overall well-being. Maybe now you are thinking, I'm spending my own money and I love smoking. If it's not good for the health, I will be sick. What's wrong with this girl? Well, if you are really thinking like this, you are wrong, because you are not the only person who is at risk from your smoking. Breathing even a small amount of tobacco smoke can be harmful. Secondhand smoking is often referred to as passive smoking. Passive smoking happens when one breathes in the cigarette smoke of others. It has been shown that passive smoking leads to lungs damages, including lung cancer and heart diseases. Secondhand smoke represents a serious threat to health. For every 8 smokers who die from smoking-related illness, one non-smoker dies from exposure to secondhand smoke. If someone smokes indoor, the harmful chemicals in the tobacco smoke can stay in the air for hours. Only a 100% smoke-free environment can protect from the effects of passive smoking. Non-smokers who live with a smoker are at elevated risk of developing heart diseases by 25 to 30%. It is especially risky for unborn babies, children, and young people and people with breathing problems. Smoking tobacco or breathing is secondhand smoke when pregnant or breastfeeding can affect the growth and health of the baby, as well as it increases the risk of stillbirth, premature birth, complication, and illness for both the babies and mother. Smoking not only impacts the smoker's cardiovascular system, but also the health of those who are around them and do not smoke. On the other hand, nicotine is the addictive substance in tobacco that causes smokers to continue their smoking habits. When a person smokes, a dose of nicotine reaches the brain within about 10 seconds. At first, nicotine improves the mood and concentration, relax muscles, decrease anger and stress. Most adults say that they smoke because of habit or routine. It helps them relax and cope with stress. It helps people to deal with their mental health problems. However, people who quit smoking tobacco shows less stress and anxiety than they previously had. Smoking only can give you a temporary refill. You feel stress-free when you smoke. It decreases your anger. Ask yourself why you want to feel stress-free. You want to forget your problems and you want to live a happy life. But smoking cigarettes, it's not the solution. It is just giving you a temporary solution and diseases for lifetime. It sounds like you are buying your death with your own money. Overall, it is clear that smoking should be banned in order to maintain a healthy environment and good health. In conclusion, I want to say that smoking should be banned because of its severe health risks to both smokers and non-smokers. Tobacco smoke affects almost every organ in the body. It is apparent that smoking impacts not just the physical health of smokers but also the health of those who are around them. Thank you for listening.